We do have a lot to get to on the coronavirus this morning. 5 more states will begin lifting stay-at-home restrictions this week, including Colorado and Tennessee. 4 other states started their reopening plans last week, Savannah.
But there is a new warning from the White House's coronavirus coordinator, Dr. Deborah Birx. She said on NBC's Meet the Press that social distancing will be with us through the summer. Also this morning, small businesses can start applying for that anxiously awaited second round of emergency funding. The program had to be temporarily shut down last week when it ran out of money.
Meantime, the U.S. is now approaching 1 million coronavirus cases. The death toll now tops 54,000. We have complete coverage. We're going to start with the push by some states to reopen. NBC's Blaine Alexander is in Atlanta, Georgia for us. Hey, Blaine, good morning.
Well, Hoda, good morning to you. For the first time in 6 weeks, this restaurant is opening its doors, welcoming customers into the dining room, seating both inside and out here on the patio. Now, all restaurants across Georgia have about 3 dozen requirements they have to satisfy before opening. That includes masked servers and no more than 6 people per table. But still, some critics say that the reopening is happening too soon. This morning in Georgia, it's round 2 of the state's reopening, with some salons, barbershops, gyms and more already up and running. Now, movie theaters and dine-in restaurants will also be allowed to open their doors.
I mean, to put it mildly, we've been going through hell.
The White House recommends 2 weeks of downward trend in new COVID-19 cases before loosening restrictions, a threshold Georgia currently does not meet. Governor Brian Kemp has said his decision is informed by data and public health recommendations, but it's drawn intense criticism from mayors around Georgia.
It's not a time to lift the restrictions.
It's absolutely premature in my mind.
I think that it is putting all of us at risk.
This week is ushering in a new wave of reopenings across the country. In much of Tennessee, restaurants and stores free to welcome customers this week at 50% capacity, but the most populated areas like Nashville still shuttered. In Ohio, the state's stay-at-home order is set to end on Friday.
It's going to be a very slow, gradual transitioning and gradual reopening.
And in New York, Governor Andrew Cuomo announced a gradual plan to reopen some parts of the state, starting with construction and manufacturing in less populated areas.
The regions that would be more likely able to open sooner would be the upstate regions.
Even the NBA allowing players to resume individual workouts at team facilities, but only if their city has reopened. The White House's coronavirus response coordinator, Dr. Deborah Birx, braced the nation for a long battle ahead.
Social distancing will be with us through the summer to really ensure that we protect one another.
But for Gary Leak, whose new restaurant setup includes disposable plates and menus and spaced out tables, getting back to business is a matter of survival.
How important is it for you to reopen tomorrow?
God, more than you can imagine. We're opening just for the sake of getting the wheels greased up to go forward. We just can't give up.
Now, guys, of course, in addition to dine-in restaurants, movie theaters also welcome to open their doors today. But as for AMC, the chain told The Hollywood Reporter that they don't plan to open any theaters until sometime in July when there are new movies to release. Savannah.
All right, Blaine Alexander leading us off. Thank you. Also this morning, new measures are being taken to ramp up testing for the coronavirus. But there's also confusion this morning over whether recovered patients actually do have immunity and won't get sick again. NBC's Gabe Gutierrez joins us now from a pharmacy in New York City. Gabe, good morning.
Savannah, good morning. We're here in the Bronx, which has the highest infection rate per capita in New York City. Now, the state's stay-at-home order won't expire until at least May 15th, and now the governor is taking new measures to prepare for that, including making thousands of pharmacies like the one behind me eligible for virus testing.
As some states start to reopen, this morning many cities are taking new steps to ramp up testing. New York's governor is now allowing all independent pharmacies in the state, more than 5,000, to conduct diagnostic COVID-19 tests.
Testing is what we are compulsively, obsessively focused on now.
With hospitalizations, ICU admissions, and deaths dropping at the nation's coronavirus epicenter, there's also an urgent push for more antibody tests to check for possible immunity. But now, a new warning: you may be able to get the virus more than once. The World Health Organization says there is currently no evidence that people who have recovered from COVID-19 and have antibodies are protected from a second infection. Still, Dr. Anthony Fauci is emphasizing the need for more testing.
Right now, we're doing about 1.52 million per week. We probably should get up to twice that as we get into the next several weeks.
California has more than 42,000 confirmed cases. Officials there are working to dramatically ramp up testing efforts.
We averaged about 2,000 tests a day through the end of March. We hope to be averaging 25,000 tests a day by the end of this month.
In Massachusetts, where cases are surging, one town is testing essential workers without symptoms. Nearby Boston, 1,000 residents will be randomly picked for voluntary antibody testing. All efforts to trace the spread in potentially asymptomatic carriers. Back in New York, first responders, healthcare workers, and all essential employees are now eligible for coronavirus testing. Pharmacist Roger Paginelli is waiting for the state health department to roll out the rules about getting tests and administering them.
We're ready when the tests are ready, and we're ready when the Department of Health says go. We're ready to put our gloves on, get our protective equipment on, and do what's best for our patients.
Now, the governor has already announced antibody tests at 4 New York City hospitals. For now, those tests will be focused on healthcare workers. Savannah.
All right, Gabe, thank you. And let's turn to NBC's medical correspondent, Dr. John Torres. Dr. John, good morning. I'm sure a lot of people who saw this sentence from the World Health Organization saying there's no evidence yet that people who have these antibodies are in fact immune from getting sick again. I'm sure a lot of people were disturbed by that. What does that mean? Is the WHO just being really careful in its language?
And Savannah, I think you're right. I think a lot of people are waking up, getting very concerned, thinking they might get coronavirus a second time. That is not what the World Health Organization said. What the World Health Organization said is, we don't know what happens if you have antibodies. We don't know how long those antibodies will protect you, if at all, because we simply don't have enough information about this virus. But their main emphasis was about the antibody tests themselves, saying, number one, we're not sure of their reliability because they have been pushed out so fast and so quickly. And number two, that passport people are talking about, the certificate of immunity, they're very concerned about that because they think people might be using those erroneously, and that could give people a false sense of security that they don't want people to have. They still want them to do all the social distancing and everything else to make sure they stay protected, not going out thinking, I have immunity, I can do whatever I want.
But back to the primary point there, we don't have the studies yet to show that there's some immunity after somebody has had this virus. But is there any reason to think that this wouldn't track with other viruses so that there's some level of immunity?
Yeah, at this point, there's no reason to think it won't be like other coronaviruses where you do get a level of immunity. But what they don't know is what level of antibodies do you actually need to get some of that immunity, and how long will that immunity last. What they have found out is that some people have high levels of antibodies. Other people who had infections, verified infections, aren't showing much levels of antibodies at all. They're not exactly sure what that means at this point. It's going to take years to figure that out. And so, again, they're trying to make sure that people don't have that false sense of security, having a positive test saying, I have antibodies, therefore I can do whatever I want and I don't have to necessarily take the precautions. They're saying, number one, again, the tests aren't that accurate. And number two, they want to make sure that people aren't getting each other infected by doing that.
Just real quickly, why have the antibody tests been such a problem? They seem to be inaccurate, leading to some false positives. There's a bunch of different types. There seems to be a black market out there. I mean, why is this such a confusing area?
And it's not just a confusing area here in the U.S., it's around the world. If you remember the UK, they ordered antibody tests from China. Now they're asking for refunds because those tests weren't that good. So it's one of those things that this virus has come on so fast and so quickly, it's hard to get a test that quick and that accurate at the same time. And plus, there have been some stumbles along the way from different authorities trying to look at validating these tests and whether they can validate them as quickly as they'd like to, so they're pushing them out faster than probably a lot of scientists are saying they should. So that combination, I think, is giving us these tests out there that aren't necessarily the tests we want or need, but that's going to take years to get. So in the meantime, these tests can help a little bit, but they're not as accurate and as reliable as we'd like them to be.
All right, makes sense. Dr. Torres, thanks for your time. Appreciate it. Hoda, over to you.
All right, now to a troubling new warning about the nation's food supply, which was already a major concern on many minds of consumers. It's coming from one of the country's top meat companies. NBC's Kerry Sanders has been covering that story for us. He's in Fort Lauderdale this morning. Hey, Kerry, good morning.
Well, good morning. This morning, there is a warning that our nation's meat supply is about to be tested. Ranchers report in the last 7 days they've sent 30% fewer cattle to market because the meat processors can't handle it. And it's not just beef. Same thing with pork and also chicken. What that means to us is that we may see less meat at the grocery store.
The food supply chain is breaking. That's the warning in a full-page ad from Tyson Foods, released in the New York Times on Sunday. It comes after one of the country's largest meat processors closed a massive pork processing plant in Iowa because of a coronavirus outbreak. The letter from Tyson's president going on to say, there will be limited supply of our products available in grocery stores until we're able to reopen our facilities that are currently closed.
Ambulances start coming to our plant. People start being carried out of there. And so we were always asking our supervisors, basically, what is it that's going on here?
NBC News talked to one Tyson worker at that Iowa plant who concealed their identity.
We didn't have enough material or masks and things like that to provide to us. So they would start giving us different types of rags and stuff that they had washed and cleaned.
Tyson responding, telling NBC News, we've been working diligently to protect our team members. Early on, we allowed workers to bring their own masks, and we even supplied some until we could secure surgical-style coverings, which we now require all team members to wear. Adding, we aren't aware of any ambulance visits to the plant for COVID-19 related reasons. NBC News has not been able to independently confirm ambulances at the Tyson plant. Tyson's Waterloo plant, one of several closed across the country, shut down by beef, pork, and poultry companies trying to contain virus outbreaks. The CEO of the National Cattlemen's Beef Association says he fears things are only going to get worse.
If we start to see panic buying, much like we did the first 2 weeks of this pandemic, then yes, we are going to have an issue on our hands. There's no doubt about it.
Meat suppliers, the processors, say in their freezers they do have a supply of beef, pork, and chicken, but the longer that the processing plants are closed, the faster the nation's meat supply will dwindle. Savannah?
It's going to get a lot of people's attention this morning, Kerry. Thank you. And now to another story we are following closely, the mystery and growing speculation surrounding the health and whereabouts of North Korea's leader Kim Jong-un. Today, senior international correspondent Keir Simmons has the latest for this on us. Keir, good morning.
Hey, Savannah, good morning. The rumors are really swirling now, including one suggesting that Kim Jong-un's surgeon's hands were shaking in fear. Now, U.S. officials have told NBC News of indications that Kim Jong-un has had cardiovascular surgery, but as ever with North Korea, it's really hard to get to the truth.
Kim Jong-un has not been seen in public for more than 2 weeks. These images are thought to show the Supreme Leader's train near the North Korean coast at a luxury compound. But on Saturday, Kim skipped his second major event, Army Day. It's a deepening mystery with rumors about his poor health and possible demise, making headlines around the globe. Reuters reporting a team including medics flew into North Korea from China. One well-connected Chinese commentator posting to millions of followers. Some wait for the official announcement. Suit yourself. Her posts later deleted, but not by her, she claims.
But I'd be shocked.
US Senator Lindsey Graham saying over the weekend, I'd be shocked if he's not dead, though admitting he does not have any direct knowledge. South Korea still insisting its intelligence shows nothing unusual. A North Korean newspaper claiming Kim even sent a letter.
How closely guarded is Kim Jong-un? How many people around him would know that something is wrong?
That would be a very small circle of people. The rumors on the ground are probably people on the outside.
When Today made a rare trip to the world's most isolated dictatorship, we found Kim Jong-un's image everywhere.
So you thank Kim Jong-un for this? Yes. Talk.
Whatever the truth, this woman may be central behind the scenes. Kim Jong-un's sister represented him at the Winter Olympics and accompanied him during his 2 summits with President Trump.
Now, it's possible, of course, that Kim Jong-un is in lockdown over the coronavirus. But, Savannah, it's so important because, remember, North Korea is a nuclear-armed nation. If it lost its leader, a weakened world would face another crisis. Savannah?
All right, Keir Simmons, thank you very much. It is 7:17. Hoda, send it to you.
All right, got a little good news, Savannah. More than 24 high school students are finally back home with their families this morning after they were stranded in the Caribbean without a flight home because of the whole coronavirus lockdown. The Dutch students were in the Caribbean on an educational cruise. They were supposed to fly back from Cuba last month. They couldn't get a flight, so organizers booked them on a 200-foot sailboat instead. After a 5-week journey across the Atlantic, they finally arrived back home in the Netherlands. Their parents were relieved. They were happy to greet them, and everybody's happy at home. But, Savannah, one of the parents said once they realize that they won't be able to leave their houses, they might want to get back on the boat. So.
I don't know. After 5 weeks, talk about an educational cruise.
No kidding.
You learn more than you bargained for. Let's get our first check of the weather from Mr. Al. You're wearing your Paul Bunyan outfit today. I like it. You got your plaid.
Well, we got snow outside again, and we're looking at more snow for parts of New England. Look at the radar. You'll see that we are expecting another 4 to 6 inches in parts of northern New England. Showers making their way through the Northeast. And as we move back to the west tomorrow, look out. 38 million people at risk for hail, 2 inches or more, wind gust of 75 miles per hour, likely with some tornadoes out there. So we're going to be watching this system pushing to the east. Heavy rain today for the upper Midwest, a risk of severe weather in the southern plains tomorrow. And then as we move into Wednesday, heavy rain for the Appalachians, these thunderstorms likely across the south. They could spur some tornadoes. And look at the rainfall, anywhere from 1 to 3 inches from Texas, the Gulf Coast, all the way into the Midwest, the upper Midwest, and parts of the Mid-Atlantic as well.